Thanks for staying with us. It is now that time of the show where we take your questions and present them to America's most trusted dentist. Let's sit down with Dr. Haas at the Super Dentists. Dr. Haas, these are my favorite segments because we get real questions from real people, and then I get the opportunity to just pass them along to you.
I love it. Me too. I love these questions. Go for it.
The first question that came in is a good one, and it's so simple. How often should I get a new toothbrush?
Okay. Well, that's another great question. So it really depends on the toothbrush, and particularly the bristles of the toothbrush. There's absolutely no reason that you want to use a coarse toothbrush bristles. The bristles need to be either soft or ultra soft. In fact, up to 74% of the population in the US have dental sensitivity, and the number one reason behind that is people overzealously brush their teeth, or they do it wrong. They use the wrong toothbrush, they brush the wrong way, and they really overzealously brush, and they damage the gums and the teeth. The softer the toothbrush is, the bristles, the more often you're supposed to change it. So the general guideline is between 1 month to 3 months. Depending on the bristles. So the softer it is, closer to 1 month you need to change it. If it's like soft, but not ultra soft, then maybe up to 3 months. Another factor is if you've been sick, you need to change your toothbrush. I see a lot of families like have several toothbrushes in a cup because the bacteria can be transferred between the bristles. You want to do that. Don't keep it near toilets, and just keep it safe. And as long as you do that, then 1 to 3 months should be perfect.
Okay, I am going toothbrush shopping after the show and rearranging my bathroom.
Yeah. Otherwise it's not going to be effective, right? And we want, if we're going to take the time to brush our teeth, we want them to be effective and safe.
Okay, great. That is great advice.
Yeah.
Okay, so here's another question that came in from one of our viewers. I heard the acid in soda can dissolve a tooth's enamel in just 20 minutes. This seems wild. Is it true?
Yeah, I'm not surprised. I mean, it depends on the soda, but yeah, teeth are the hardest substance in your body, right? The enamel is even harder than bone. So the fact that soda can dissolve enamel, just imagine what it does to other parts of your body, to your intestine and your GI tract and other parts. So I have patients, unfortunately, that over the years that they have a soda habit, or they are on medications, or some reason their teeth are just like the enamel is completely worn down. We almost have to do near full mouth reconstruction in their mouth. And so yes, there's no reason to drink soda. Some sodas have literally more sugar, and they have liquid. And so if you ask me what's the worst thing you can do for your teeth, is probably drinking soda.
All right, good. I don't have soda in my fridge, but I do need a new toothbrush. Okay, here's another question that came in that I thought was good. Is it true that never brushing your teeth at night increases mortality risk by 20 to 35% compared to nightly brushing? And if so, why is this?
Yeah, that's another great question. That is true.
Wow.
And also not flossing every day adds 30% to your mortality risk. So the reason is your oral health is linked to almost every chronic disease. And let me just give you 2 reasons why. Your mouth is filled with billions of microbes. We call them collectively as your oral microbiome. Somewhere between 5 to 100 billion microbes. Just think about that number, right? And so when you have bleeding gums, let's just say you have poor oral health. So your gums bleed when you floss or brush, or you have a cavity in the tooth. So the bacteria in the mouth have access to your bloodstream. Once they get into your blood, where does blood go? Everywhere, right? It can go to the heart, it can go to the lungs, it can go to the brain, it can go to an unborn baby. And it can cause local infections, or it can cause systemic inflammation. And because of those 2 things, it increases the risk of all these systemic health problems. And because of all these increased risk of systemic health issues, it increases the risk of early death and premature death.
Wow. So, I mean, going to the dentist really is about more than just having a white, bright smile. It really is important for your whole health. And you get into all of that in your book. This is a USA Today and Wall Street Journal bestseller, If Your Mouth Could Talk. And this is important for every individual to read, and it really is a quick, easy read.
Yeah, I mean, I wrote it for the average parent, average adult, but I also wrote it so even our medical and dental profession take notice of it, because unfortunately, because medical schools and dental schools are separate, the mouth's health is kind of fallen through the cracks. And so I hope this is a good guide for everybody to really realize how important their oral health is, and they take it a little bit more seriously and brush and floss and use the right oral care products.
Okay, Dr. Haas, you are known as America's most trusted dentist. I can't wait to ask you more questions next time.
Thanks so much.